So, yeah, we have a last speaker, probably maybe the best. So, Dr. Sushmita KAUSHIK, who's a professor at Advanced Eye Center. And of course, these are just a few of her achievements. Probably there are a lot of pages, so probably I can't be reading each and every achievement. No doubt she's done a lot of work in pediatric glaucoma, and probably it doesn't need that much of an introduction. I'll request her to please start off with the presentation.
Thank you, Jaspreet. It's always nice to have close friends on the panel because they're very kind to you. Thank you for having me on your course. He told me to present, can the slides move, please? Yeah. So he told me to talk about the one case, but I'm going to talk about the one case which taught me so much and made me eat a lot of humble pie. So this is story one. You think you're a hotshot pediatric glaucoma person when people refer to you from far and wide. So this is like unilateral PCG. Something is in your head that why are these unilateral, but we've seen them, so acha they are. Literature says 25% of ophthalmos are unilateral. We do a combined trab with trab, and he does fine. The cornea clears, the pressures are fine, so far so good. 1 year later, the pressures start rising. We do an additional goniotomy, and something tells you something is amiss because there's some sort of ptosis, but then you've learned that ophthalmos and large eyes can also have a pseudotosis possibly, and you're wondering, okay, maybe that's the reason. And then 3 years later, again, the pressures are rising, and this time he's required a tube. So we go in, we put in the tube, the cornea clears again. Now the ptosis is a little marked. And at 7 years, he's controlled on 3 meds, but now I'm not bothered about the glaucoma as much as the ptosis. So why intractable glaucoma and why the ptosis? And by then we have the whole exome, which is affordable. And we screen and we do a targeted, which they call a clinical exome sequence, which is 6,500 genes which are analyzed for all the exomes that have been implicated in disease. There's no pathogenic variant, but I get an email. So this is the report that I get. There's no pathogenic variant because the phenotype that I put in is intractable glaucoma, congenital, and ptosis. So I get this email saying, we haven't found your phenotype, but what we found is a splice problem in the intron of NF1. And then I tell my residents to call him back, lift up his shirt, and there are the cafe au lait. And then you really, really eat humble pie that for 7 years you actually hadn't examined the child completely, but the parents swear that these are recent onset over the last 2-3 years, and they really weren't there when he was born. So you sort of think that possibly you're okay, then that you didn't really miss it, they actually weren't there. And then you ask the lab, and this is the conversation you have to have, you ask the lab to include NF1 into the report, and this is the final report that we get, it's likely pathogenic. So this was an oversight because we then screened for optic nerve glioma, we screened for the sphenoid, we screened for the cranium, and he did have a posterior optic nerve glioma, which the neurosurgeons are saying hold on to because it's not progressive as yet. Let's see how it works. So then once we had this insight, this oversight, the universe sends this 3-month-old baby with unilateral glaucoma, and this time we are sure and we say, okay, let's see, look for the cafe au lait, and there we are. And yes, so now we know how to diagnose neurofibromatosis in a case of unilateral newborn glaucoma. The ptosis was marked even after surgery, but we looked at the mother because she would never come in, and he would come in with the dad. And in the kind of crowds that we have, we are so thankful that the child is brought in, we don't really ask. So at this time we asked the father, is the mother in? Where is she? Because he looked completely fine, and there you are. She has leash nodules, she has plexiform neurofibromatosis, and she would always sit with the ghungat or the sari right down to here, because not so much modesty as much as she didn't want people to see her face. So of course there was NF1 again, and we didn't have to wait for genetics to get the whole gamut of a pediatric and neurosurgery referral, and both of us are following up this patient as well. So then we have a 3-month-old baby where the mother complains of drooping of the right eye, and it was enlarged, and we immediately looked for cafe au lait again, and they were glaring because this time they were on the cheek and they were scattered on the trunk. So we clinically diagnosed again, NF1, sent to peds, sent the sample, and of course it came back with an autosomal dominant NF1 as well. So the older stories came back to haunt us, because whenever I don't understand anything, I put them all into a folder saying weird iris, weird cornea, weird this, weird that. And I came up with one which said unexplained unilateral glaucoma, and there you are. Today, I would have diagnosed this baby as NF1 possibly, just looking at that S-shaped lid. But at that time, I had honestly no idea. The cornea clears, the pressure lowers for some time, and as the child grows, the S-shaped lid comes up. We lost this child, and they came back to the ER with panophthalmitis, which had to be removed because the parents just disappeared over the next 2 or 3 years. And now, of course, he's grown up. He's a 6-year-old naughty boy, but he has a prosthesis. And we hope we've given him some life despite losing that eye. So the key takeaways is always be suspicious about unilateral newborn glaucoma. You never know. And unless you've ruled out everything possible, don't just think it's de novo. Look out for abnormally shaped lids. That's what we now know. Look out for cafe au lait spots. They might not be so obvious when they're very young, but keep following them up. Make sure to get a systemic evaluation, especially for a CNS involvement, and take the help of genetics whenever in doubt. I acknowledge the series of senior residents who work hard to make me the little that I possibly am, and I invite you all to the Indian Pediatric Glaucoma Society meeting in Madurai in December this year. Thank you very much.